Pancreatic cancer. What is it? A tumor is formed when aberrant cells in the pancreas expand and divide uncontrollably, signaling the start of pancreatic cancer. Nestled between the stomach and the spine, deep within the abdomen, is the gland known as the pancreas. It produces hormones that regulate blood sugar levels and digestive enzymes. Cells comprise organs such as the pancreas. Cells normally divide to create new ones when the body requires them. Older cells eventually die and are replaced by new ones. This procedure pauses occasionally. When the body doesn't need new cells, they form or existing cells don't die. The surplus cells may aggregate into a massive tissue known as a tumor. Certain cancers are benign. They cannot infiltrate other body parts, despite the fact that they are aberrant. Cancer is the term for a malignant tumor. The cells can spread to other tissues and organs when they grow out of control. If the cancer originated in the pancreas, it remains pancreatic cancer even after it has spread to other parts of the body. It is common for pancreatic cancer to spread to the liver, lungs, bones, abdominal wall, and/or lymph nodes. Types of pancreatic cancer. Exocrine or neuroendocrine, endocrine tumors are the two types of pancreatic cancers. Depending on the kind of cell they begin in, it's critical to identify the type of tumor as they all behave differently and react to therapies differently. Exocrine tumors account for more than 90% of pancreatic cancer cases. Adenocarcinoma is the most prevalent kind of pancreatic cancer. Why does pancreatic cancer occur? Cancer arises from mutations in your DNA. These may develop over time or be inherited from your parents. The changes you experience over time may be the result of hazardous exposure. They may also occur at random. The precise causes of pancreatic cancer remain unknown. It is estimated that 10% of pancreatic tumors are inherited or familial. The majority of pancreatic cancers occur at random or are brought on by factors including aging, obesity, and smoking. You may be more likely to have pancreatic cancer if you are a first-degree relative of someone who has been diagnosed with the disease. It is highly advised that you have your family member with pancreatic cancer tested for hereditary mutations through genetic testing. If the results are positive, unclear, or you have multiple close family members who have cancer, the Pancreatic Cancer Action Network suggests you speak with a genetic counselor to decide whether to get tested for inherited cancer risk and whether to talk about monitoring options. Negative results typically indicate that you do not need to get genetic testing. Additionally, a person's risk of developing pancreatic cancer may be increased by smoking, chronic and genetic pancreatitis, long-term diabetes, and obesity. Diets heavy in red and processed meats. Gender, males significantly more likely. Age, over 60, and race, ethnicity. How is pancreatic cancer diagnosed? Only an imaging investigation such as an endoscopic ultrasound, EUS, magnetic resonance imaging, MRI, or computed tomography, CT scan, can detect a pancreatic tumor. To determine the precise diagnosis, the physician then obtains a sample of the tumor tissue. Why is it hard to find pancreatic cancer? Due to the pancreas's deep abdominal location. During a physical examination, clinicians typically are unable to feel or see the tumor. Furthermore, pancreatic cancer symptoms typically appear gradually and are not always evident. To diagnose a patient, doctors may perform a number of tests. However, there isn't a common test to identify pancreatic cancer. This further complicates the diagnosis. What treatments exist for pancreatic cancer? The course of treatment for pancreatic cancer is determined by the disease's stage and the patient's overall health. Patients may participate in clinical trials or receive standard authorized therapy. Radiation, chemotherapy, and surgery are standard therapies. Clinical trials investigate novel therapeutic approaches. Clinical trials are highly recommended by the Pancreatic Cancer Action Network at the time of diagnosis and for all treatment decisions. Why is pancreatic cancer hard to treat? For an extended period, surgery provides the best chance of managing pancreatic cancer. However, the majority of individuals receive a diagnosis much later and are not candidates for surgery. There is an urgent need for tests to detect pancreatic cancer in its early stages. Researchers anticipate that as long as early detection research is conducted and technology advances, we will get closer to identifying the illness early. And further difficulty is that the stroma, a layer of thick tissue, envelops pancreatic tumors. This complicates the delivery of medicine to the tumor. To increase the efficacy of treatment, researchers are looking into several delivery methods through the stroma. Additionally, some tumors have responded well to targeted medicines that prevent particular mutations. However, these medications have not yet been created especially to treat pancreatic cancer. Tumor tissue biomarker analysis and genetic testing for hereditary mutations provide insights into your own biology. The outcomes can be consistent with focused therapies that are effective for other forms of cancer. New research will be done before new specialized therapies for pancreatic cancer patients with certain genetic abnormalities are created and approved.